Hello and welcome to Cancer Council ACT's Let's Chat Sex, Intimacy and Cancer podcast. Today we're going to be talking about libido. We've got sex therapist Andrea back to help share some insights and specifically help you understand what causes a decreased libido. So Andrea, why does libido decrease after a cancer diagnosis?
I think to understand that, Ash, we need to remember that sexual function, including desire, it's influenced by our physical, emotional, and physiological condition. So cancer and its treatment, if we think of surgery, chemotherapy, radiation, and hormone therapy, can directly affect the hormonal balance associated with a sexual arousal. Hormone therapy such as androgen, estrogen, and progesterone deprivation therapies can significantly impact sexual desire. These are hormones that are directly associated with sexual function, from the brain reward system around physical arousal to performance. So a deprivation of these hormones or any changes in these hormone levels can result in a decrease or absence of sexual thoughts, fantasies, or dreams. Through the cancer treatment, people often experience physical changes that are less than sexy. For example, treatments may cause fatigue, pain, nausea, nerve damage, lymphedema, sometimes changes in bladder or bowel function, all of which can impact on, that mental space that allows for sexual arousal. And then there's body image issues such as scars, hair loss, or change in weight, which can also reduce self-confidence, and that in turn can impact on libido. And then there's that emotional impact. The stress and distress around a diagnosis can trigger feelings of anxiety, depression, and general uncertainty about the future. These emotions will directly impact the way you feel as a sexual human being and that ability to enjoy sexual intimacy.
It really does sound like all aspects of cancer can play a big impact. And even one of those areas you mentioned would have an effect. But the combination of several, such as medication, body image changes, and shock and stress, must all stack together to impact on people's sexual experience. So, in practice, then, how have you seen decreased libido actually affect individuals and relationships?
So certainly a reduced interest in sex can have a ripple effect on the personal relationships and on the individual's sexual self-esteem. As I mentioned earlier, the person with cancer might feel grief over changes in sexual identity, the loss of that ability to have sexual thoughts or desires. There can be guilt or frustration that comes up for people, and it is not uncommon for feelings of shame to show up too. When given a chance, I hear people talk about missing having a libido, missing feeling aroused and interested sexually in another. For partners, this might be very confronting and confusing. Feelings of rejection and uncertainty might come up. Some partners report feeling shut out of the relationship, but also experiencing some fear around not wanting to hurt their partner and not knowing what's okay. But I also want to make this other point that we are talking about individuals and everybody is going to experience this differently. And for some people, this is a change, but it's not a significant or an impactful change. And some people accommodate it quickly and others might take more time. For others, in a relationship, this might be a bit of an equalizer. It is not at all rare or uncommon for couples to have mismatched libido. So it might just happen that couples might end up having a more even sexual desire. But even in these circumstances, again, I don't want to minimize at all that a change of libido might still bring an experience of loss for the individual, either the person with cancer or the partner. So I cannot emphasize enough how important open communication is in this regard, as well as deep understanding of the reason this is happening and how each person in the relationship is experiencing these changes.
Yeah, thank you so much for your insights, Andrea. From what you've said, it really does seem like understanding why these changes can happen, and especially that point about open communication for people is really important. Now that we have some idea why this is happening, next episode, Andrea will have you back to help us find some strategies and techniques to help people manage a decreased libido. Thank you so much for joining us, Andrea, and everyone for listening, and bye for now.
Bye for now.